field epidemiology training program is incredibly beneficial for global health. It creates and builds a network of field epidemiologists to be able to respond to public health threats, to be able to detect public health threats, and then also to prevent them. In addition, it builds a country's surveillance and response capacity, especially at the community level, where we see the importance of being able to develop the trust and relationships with communities so that when events occur, they will report them, they will engage. And the field epidemiology training program builds that relationship over time, because you cannot do that in a crisis setting when an event is occurring. And then thirdly, I would say, it extends the opportunity for the Centers for Disease Control and Prevention to work globally, working with ministries of health, but in areas at the front line. So it extends our ability to be able to build capacity from the lowest level to the national level. And that then forwards into a regional and to a global effort. An field epidemiology training program is critical in these efforts and beneficial to preparedness to stop global health threats. The most critical issue facing field epidemiologists today is understanding the changing environment that we are facing, the world that we're living in today, and understanding. We see with urbanization that 70% of the world will live in urban settings by 2050. That means people will be living in close areas, and that's the opportunity for diseases, especially infectious diseases, to spread rapidly. But we also see one of the biggest challenging for them is how do we ensure the sustainability, that there will be the resources and the training to build these programs in countries so that this can be sustained for long term. And then the third important and critical issue that they're facing today is, in a changing world of insecurity, in conflict, how do we make sure that we're still able to make sure we can have diseases reported, that we can respond, and that we can prevent them. And I think working in this environment is very difficult, and people are at the front line trying to engage with communities, to engage with health systems, national as well as private. And it's very critical, and I think how to balance and to work in that environment is very critical, something that they have to figure out today. The TEPHINET conference, this is the 10th annual conference of this, is phenomenal, and to really push forward the field epidemiology training program. And today we're launching the FETP Enterprise, which is incredible to see how we have engaged at the highest global levels partners to come together and understanding the value of the field epidemiologists and how we align that into the Sustainable Development Goals, into universal health coverage, and into the global health security agenda work. This, as well as what has been done and built through initiatives to eradicate or eliminate diseases, gives us a strong opportunity to align all of the work that's been done and bring it together to have a strong program and a network, a global network of people to be able to respond to events, but also then to make sure that we have a way to sustain the incredible resources and the importance of the resources that we have to date.